Hey everyone, welcome back to the channel. This is Aryan Malik, and this is the series Study With Me Part 2, in which we'll be continuing with drugs. The next drug is TPN, Total Parenteral Nutrition. The thing to remember is one bag is given only for 24 hours, and the tubing in which the solution flows, it's filtered every 24 hours. It can either be given centrally or peripherally, and registered nurses give the TPN, and we usually order it through the pharmacy, and we need to refrigerate it and take it out 30 minutes prior to its administration. And its initial rate can be 15 cc's to hour, which can range to around 100 to 125 milliliter per hour as per the order from the provider, and it should be given by the pump. One thing to know about TPN is when the patient is on TPN, we monitor for sepsis, which is infection, and report any signs to the provider. And a sterile dressing should be maintained, and it can also be checked by the LPN as well. When giving a TPN, we monitor for glucose levels, mainly hyperglycemia, high glucose levels, and some lab values to check while giving this medication is electrolytes and BUN. We need to report any um, abnormal values that we see. And when it comes the time to discontinuation, we need to be very careful that this medication should not be stopped abruptly, as it might lead to rebound hypoglycemia or sudden fall in glucose levels. It should be tapered down, in other words, decreased slowly over time. So it should be tapered down, and showers should be prevented for these patients. The registered nurse should give them bed bath. And a question might come like, when is usually TPN given? So it is when the patient has having a GI or absorption problems. So one of the NCLEX questions that I saw were, a patient is having difficulty swallowing. What method of food nutrition, or how will the a patient get their food? So one option was TPN, other was an oral suction. So whenever it's a GI problem, we go with TPN. Otherwise, we can just go with an NG tube. I beg your pardon, it's NG tube, not oral suction. Whenever a patient is having problems in swallowing, we give them an NG tube. Um, and the next thing which comes regarding TPN is how to know if it is effective. If the patient is maintaining their weight, they are not losing nor gaining weight, that means the TPN is doing its work. And the next medication that comes to my mind is fluoxetine. Its other name is Prozac. It's a selective serotonin reuptake inhibitor. It's a depression medication, and it is given to patients with obsessive compulsive disorder. When we give this medication, our responsibility as a registered nurse is to monitor for hypertension, dry mouth, weight loss. If a patient is discharged with a dose and they miss a dose, we instruct them to omit that and start with the regular schedule. We do not want them to double this medication, which could have some severe effects. And one other question which might show up regarding depression medication is that patient said, okay, I was started on this medication a while ago, why I am not seeing the effect? So please remember that depression medications take 2 to 3 weeks to show their effect. And so that's what we inform the patients. Next medication is propanolol, which also is called Inderal, and it's a beta adrenergic blocker. It is given for blood pressure. It's a antihypertensive medication, which means when a patient is having a high blood pressure, we prefer giving them propanolol. Its side effect is bronchospasm, bradycardia, and Before giving this medication, we need to check patient's heart rate and pulse rate. Um, if the patient's heart rate is low after giving this medication, we inform the provider because that's one of the side effect of this medication, and we need to, as I said, take pulse and heart rate uh, before the medication is administered. And same thing for propanolol, that once it's given, it should not be stopped abruptly, as the patient might go to hypertensive crisis. So it should be discontinued slowly. It should be tapered off slowly. The next medication is glipizide, which is glucotrol. It's a oral hypoglycemic. It's an oral medication, and it's mainly for diabetic patient, and in diabetes also type 2 diabetic patients. What it does is basically decreases the blood sugar by stimulating insulin release from the beta cells of the pancreas. A side effect of this medication is aplastic anemia, which means that body stops producing new red blood cells. And another side effect is photosensitivity, which means skin becomes sensitive to light. And in many oral medications, one side effect which is common across the board is diarrhea and rashes. A lot of diabetic patients taking oral medications exhibit diarrhea as a side effect. The next medication is prednisone, which is also called Deltasone. It's a corticosteroid. So anything that ends with zone, SONE, it's a steroid. And for example, hydrocortisone, fluticasone. So what do we monitor when we give steroids? We monitor for hyperglycemia, the sugar level, and we also monitor for fractures. When giving steroids, the patient can turn to Cushing syndrome, which means that they will develop high fat towards their belly region, and they will lose fat when it comes to their legs. Their sugar will increase and they will retain more sodium, leading to excess of weight and low potassium and calcium level. And that is the reason why we monitor for fractures, because low calcium levels can lead to fractures. The patient is also at risk for infection. So any patient who is at risk for infection, we put them in something called reverse isolation, as their resistance is low. So we want to make sure that they are not around other patients or other areas from where they might catch an infection, because that can be lethal to them. Again, for steroid, it should not be discontinued abruptly. If it is, patient can go to adrenal insufficiency or Addison's crisis. So we all know we have two adrenal glands which are right on top of the kidneys. So if a steroid is stopped abruptly, a patient can it can lead to adrenal insufficiency. The next and the last drug is Bethanechol, which is also called Urecholine. It's a cholinergic, and it is a drug which is used for the treatment of urinary retention, and mainly given when patient is unable to pee, and it lowers the acetylcholine, which makes sure that the patient is able to come back to their normal function levels. I hope you like the part 2. Stay tuned for the part 3, which comes tomorrow. Thank you.